I'm really, really delighted to introduce you to Taryn Hutchinson, who's a psychology graduate and who joined my lab, the Researching Emotional Disorders and Development Lab at King's in 2019. This was following a master's in clinical and health psychology and a postgraduate course in low intensity psychological treatments. She's also worked as a psychological wellbeing practitioner within CAMS. So she was really, really well suited to the funded project here on adolescent depression that she'll be telling you about in more detail in a moment. On a more personal note, Taryn has a global childhood. She was born in South Africa, lived in Guernsey, and I found out yesterday from asking her to send me her CV that she is also a keen surfer and also writes fiction too. So I'm going to let her tell you more about her academic project. Thank you.
So hi everyone, as Jennifer said, I'm Taryn, and today I'm going to be talking to you about how young people have been using future mental imagery to manage their emotions during COVID-19. So my PhD is focused on adolescent depression, which is a common mental health problem and often begins in adolescence. And depression is characterized as the presence of extreme negative affect, as depicted in these images, but also a lack of positive affect, which is also known as anhedonia, which is the loss of pleasure and enjoyment from usually enjoyed activities. Specifically within my PhD, I'm interested in the role of mental imagery in adolescent depression. So mental imagery is described as seeing with the mind's eye. So it can be positive or negative, and images can be deliberately brought to mind, such as when you're planning, or they can be more intrusive and upsetting. Adolescent depression has been linked with less vivid positive future imagery and more negative, greater vividness of negative future mental imagery. And what we find from experimental studies is that simulating positive future mental events can make the rating of those events more likely to occur, more controllable, and seen as more important. So this suggests that engaging in positive future mental imagery can increase motivation to work towards goals. So subsequently, my PhD was funded to test whether increasing the vividness of positive future mental imagery would improve symptoms of depression, particularly anhedonia. And in my first year, we were working towards developing an intervention manual, which we'd then take into schools and do a case series to see how young people responded to the intervention first of all, and sort of fine tune it ahead of the randomized control trial where we'd test it out. Unfortunately, as everyone knows, the pandemic has hit, just as the case series was about to begin. So we wanted to really use the opportunity that we have from the pandemic to maybe think about how young people might be using future mental imagery to regulate their emotions in this time. So most studies that have looked into responding during the pandemic have focused on adult populations, but there's research to suggest that actually young people might be at greater risk of negative psychological events from pandemics due to uncertainty around their education, stopping of their recreational activities and hobbies, uncertainty around the health of their family, and changes to socializing with friends. So all of those things can contribute to having a negative experience. But we'd wondered whether actually the ability to engage in positive future imagery would be a protective factor, as positive mental imagery is associated with optimism, which is largely characterized as positive expectations for the future. And optimism is really strongly linked to psychological well-being and resilience. There's also evidence to suggest that positive future imagery might promote positive affect after a negative life event. So in this study, we we had a number of questions about how mental imagery might affect both negative affect and anhedonia. So our first hypothesis was that an increased vividness of negative future imagery and reduced vividness of positive future imagery would be associated with greater symptoms of negative affect. And our second hypothesis was that increased vividness of negative future imagery and reduced vividness of positive future imagery would be associated with increased symptoms of anhedonia. So to gather this data, we conducted an online survey where to measure future mental imagery, we asked young people to rate how clear and detailed they saw 7 positive and 7 negative scenarios. So some examples here are: you will do well at schoolwork or school and work, or you will have a serious argument with a friend. We also asked them to rate their levels of negative affect, which is characterized by a series of negative emotions. And we also measured anhedonia, which had a scale of how much people would enjoy activities, such as I would enjoy a warm bath or refreshing shower. And this was the data that we collected. So just over 2,600 young people took part in our first baseline survey, and they were aged between 12 and 25. And as you can see from just some characteristics of the participants, we had a greater number of female participants than male participants. In terms of the representativeness of our data, so we pretty much contacted every school in the UK to try and get a representative sample. But what we found, comparing our data with the Office for National Statistics, we found that actually our sample might have a higher socioeconomic status, which was measured by parental education levels, and maybe a lower proportion of participants describing themselves as white, but a higher proportion of participants identifying with minority ethnic groups. So looking into what we found, we found that regardless of whether, first of all, imagery was positive or negative, there was a difference between males and females. And what we can see here when we unpack that a little bit more, we found that the darker line represents, I wonder if I can point at the darker line represents females, and we found that female participants experienced less positive future mental imagery and more negative future mental imagery than the male participants. We also looked at the future mental imagery if there was any age differences. And again, what we found was that regardless of imagery being positive or negative, there was a difference in the groups of how they used their age. So, sorry, I should say that we separated the groups because it was quite a large range between 12 and 25. We separated them into younger adolescents, 12 to 17, and older adolescents, 18 to 25. And what we found here when we unpacked this a little bit more was that the older adolescents experienced less positive future imagery than the younger adolescents. We had a look as well about to address our hypotheses, and what we found was that negative affect and negative future imagery had a positive relationship with each other. So as we expected, that increased negative future imagery would increase negative affect. And we found that with positive future imagery and anhedonia, we found a negative relationship, which again makes sense that actually if you've got less positive future imagery, you might have greater symptoms of anhedonia. And so for the next section, we've already seen that age and gender and positive and negative future imagery have been associated with our outcome variables of negative affect and anhedonia. But we wanted to see whether these associations kind of still hold when other factors are controlled for. So what we did here was we found that when we controlled for age and gender, we still find that negative future imagery is the strongest unique predictor of negative affect. And similarly, when all the other influences are controlled for, positive future imagery is the strongest unique predictor of anhedonia. So in conclusion, we found that increased negative future imagery was associated with increased symptoms of negative affect. Decreased positive future imagery was associated with increased symptoms of anhedonia. Female participants experienced less positive future mental imagery and more negative future imagery than male participants. Older adolescents, so those aged 18 to 25, experienced less positive future mental imagery than the younger adolescents. And when age and gender were controlled for, negative future imagery and positive future imagery were still individual predictors of negative affect and anhedonia, respectively. Thank you so much for listening, and please let me know if you've got any questions.